आप लोग सभी आए, आपने रिस्पॉन्ड किया हमारे इस रिक्वेस्ट को, और मैं चाहूँगा कि इनफॉर्मल चर्चा हो, कपूर जी उसको लीड करेंगे। जो भी बोलना चाहे, देयर इज नो हार्ड एंड फास्ट रूल। आइडियाज दीजिए कि व्हाट नीड्स टू बी डन टू सी दैट द abysmal condition of health care, thinking in terms of the mass of the people that obtains today, how that can be changed, क्या किया जा सकता है। ये ठीक है कि बहुत अच्छा हेल्थ केयर भी है, और फिर क्योंकि रिलेटिवली इंटरनेशनल कॉस्ट के हिसाब से यहाँ पर खर्चा नहीं है इतना, इसीलिए बहुत सारे लोग तो हेल्थ टूरिज्म के लिए आते हैं हिंदुस्तान में, ये भी बात सही है। और लेकिन शासन में आए हुए व्यक्ति जो कुछ करना चाहते हैं, इस स्थिति को ठीक करना चाहते हैं, वो क्या कर सकते हैं, इसके लिए जो भी आप आइडियाज देंगे दे आर वेलकम। मैं एक बार पुनः आप सबको धन्यवाद देता हूं कि आपने रिस्पॉन्ड किया और आप सभी आए। I hand over the meeting to Kapoor ji. He will guide it.
Thank you, sir. You already set the tone for the discussions, but I'll just make 2 or 3 brief observations. First of all, I want to point out how terribly neglected the health sector is. Sir, the total public expenditure, central and state governments put together, is about 1% of the GDP. About 0.26% being by the central government and about 0.73% by the state governments. To put it another way, I was looking at the midterm appraisal of the health plan. The per capita expenditure, public expenditure, was about $3 at 93-94 prices and $5 per annum at the current prices. It may have now gone up with changing exchange rates and a little bit increase in our GDP. It may have gone up to, I don't think, more than $7 to $8 per capita at the current prices. It's woefully low. Then I was also looking at the results of the recently released National Family Health Survey. This is the 3rd round. So the infant mortality rate is still 57 per 1,000 children, way below the target. Just about equal to that of the least developed countries. 2.5 times that of China. 8 to 10 times that in the developed countries. Great shortfalls in immunization targets. Today, you will be surprised to know that the supply of vaccines has been greatly affected because 3 of our PSUs got closed for non-compliance with the WHO standards. And the vaccines are not reaching the grassroots level. These are the 3 central PSUs. And 43% of children suffer from moderate to severe anemia, which shows failure of the ICDS, the Integrated Child Development Scheme. 52% childbirths in the absence of a qualified health worker. Incidence of TB, malaria, diarrhea continues to be very high. Shortfalls in health infrastructure, sub-centers, primary health centers, community health centers, there are great shortfalls in numbers, poorly staffed, poorly supplied. The National Rural Health Mission, which was one of the flagship schemes of the present government, has been a very marginal success. It hasn't made the impact the way they wanted to incorporate the Panchayati Raj institutions into the whole arrangement for health in the rural areas. That hasn't progressed at all. Private health care is expensive. Weaknesses in the regulatory arrangements, and in the enforcement of standards. So that is the kind of situation that we face. I'm saying, sir, that when you are promising health for all in the BJP's manifesto, I would submit that this is going to be one of the toughest challenges before any new term. Upgrading the healthcare in this country. It is abysmally low, as I said. It is in an utter state of neglect. Secondly, sir, I would like to point out, because of the multidisciplinary character of the experts who are around this table, there are people who have made medical achievements to their credit, who are connected with medical education, management of healthcare, people who are dealt with health policy for a long time. We have people from the alternative systems of medicine. And we have people, sir, who have specialized in medical insurance, which again is a very important part of the discussion. So in this multidisciplinary group, I suppose we would try and put together a model which is inclusive in all senses of the word. It must involve central state governments, it must involve the local bodies, the panchayati raj institutions. It should involve the public sector, the private sector. It must include all modes of medicine. It must give attention to prevention, treatment, actually the wider concept of wellness. And it must use the new means of delivery which are becoming available. Your letter, sir, you have mentioned telemedicine, you have made mention of the health insurance. These are the new methods of delivery which are becoming available, and we should be able to bring them into play very actively. Manpower problems, there are drug policy, standards and norms, medical education. These are very important issues. Finally, sir, I would say that in our manifesto, we have made a specific mention of a group insurance scheme in which the premium for people below the poverty line is underwritten by the government. And people get their treatment and even surgeries on a cashless basis from public institutions as well as from the private facilities. This, I submit, can be a very important initiative. We should be able to have a specific discussion as to how to develop this approach that we have indicated in the manifesto.